Good morning. Welcome to Apache Junction Clinic here. Have you all been here before? Show of hands. No, you've not been here. Well, welcome. Do you live in Apache Junction?
Go Canyon.
Oh, Go Canyon. So not too far, 15 minutes away. That's great. Well, this is our 9th clinic for those of you who have never been here. So we're really super happy to be in this area. Once fall hits, it's going to grow from 40,000 to about 80,000 people. So we anticipate adding more providers, but really happy to have Daniel talk to you today about inflammation, because I know I even get it. I just turned 55 and there's some things that get a little swollen at times, so he'll have some really good helpful hints for you. It's a small group, so I'm sure we can be interactive as we go through the presentation, but maybe silence your phones, things like that, just to keep distractions away. But Daniel opened this clinic on June 8th, so he's our provider. He started it. He got full really quick. He was at our Red Mountain location on Power and Brown for a little over a year, and then they saw what great work he did, so they wanted him to open this clinic here. So he graduated from University of Arizona, and he finished at Yale Medical School, so very well educated. I like to go to Daniel myself. He's my guy, that's who I go to. So, but yeah, I'll have Daniel just kind of take it from here. So please welcome Daniel Ramos.
Excellent, thank you, Tom. I'll pull this mask off so you guys can make sure you hear me, but I'll make sure to stay far away from you, just with everything going on. But yeah, my name's Daniel Ramos. Thank you guys for coming in today, and thanks, Tom, for that introduction. So today we want to talk a little bit about inflammation and arthritis. So something that will plague all of us eventually, just with the wear down of body. So we're going to talk about that. We're going to talk about some things we can do to try and decrease inflammation, and some things we can do to better help arthritis in our lives. So just a little bit more about Hatfield Medical Group. We were founded in 1969. We have 9 East Valley locations, and we're currently expanding. So a lot of options. I was just talking to someone just a minute ago. If we need to get you in here, but you're usually seeing Dr. Lewis over at Red Mountain, but we're having a hard time getting you in, we can see you at any of the offices. We have the same records. We just want to make sure you're taken care of, okay? We're a primary care office, primarily focused on our Medicare patients. So we have a lot of resources to really help as we get a little bit older. We might need a little bit more help, a little bit more time with our office appointments. So we intentionally limit how many patients we see an hour so we can spend a little bit more time with you. So we have other coordinators. We have some coordinators that can help you with your insurance. So if you're having a hard time knowing what your insurance covers, we can have someone help you with that. If you have chronic medical condition, we have some chronic care managers that can help you with that, and they can call you up every month to make sure everything's going okay, that you're taking your medication. So a lot of resources that we offer here. We provide good access to care for our patients. So with our multiple offices, we can usually get you in same day, next day. Ideally, we want to have you see your same providers because you've already developed that relationship with them. They know about your medical condition, you feel comfortable with them. But if we need to get you in for something else, we can try to get you in that same day if possible. And then just in general as a whole, the way our practice is set up, we're primarily focused on preventative care and good outcomes for our patients. So we're not just churning patients in, seeing as many patients as we can see throughout the day to bill your insurance company. We're primarily focused on your health outcomes. So we want to make sure we're taking good quality care and giving our patients quality and compassionate care every day. All right, so a little bit about this class. It's going to last about 30-40 minutes. Things that we're talking about may not be specifically applicable to you. You just talk to your provider if you have any questions about this specifically and in regards to some of the recommendations with your health conditions. And this is a safe zone, so feel free to ask questions. We'll have time at the end, especially to ask some questions. But if you have any questions throughout, just raise your hand and let us know, and we'll try to address those too. So today we're going to talk about arthritis and inflammation and how we can decrease inflammation. We're going to talk about how diet affects our health. We're going to talk about different foods that fight inflammation. We're going to spend a lot of time talking about that, foods that fight inflammation and what we can do proactively to decrease inflammatory levels in our body. We're going to talk about foods that make arthritis worse and things that we need to avoid, and just some other tips for dealing with arthritis as well. All right, so arthritis in your diet. So arthritis is very common. There's about 50 million adults in the United States that suffer from arthritis, so some type of arthritis. There's over 100 different types of arthritis. So the primary type of arthritis is osteoarthritis, which is really the wear and tear of bones that we experience throughout life, mostly from some chronic medical conditions, and a lot of it's just gravity, just wear and tear on the bones. Osteoarthritis is the breakdown of cartilage in those joints. So cartilage is like a soft covering over the bone that allows flexibility and mobility of those joints. And as that wears down and that breaks down a little bit, we get this bone on bone, which I'm sure you guys have heard of before, which is essentially what arthritis is. And that causes inflammation, swelling, and pain. Some things that we may not have known is there's certain foods that can help control inflammation. So that's what we want to talk about today. There's not really a magic diet, so very specific foods that you have to eat or a very specific diet that you have to eat. We're going to talk about regular types of foods that we'll eat throughout our day that will decrease inflammation. So we'll chat about that a little bit today. And then healthy weight. So that's another important part of improving your arthritis and improving your pain, is maintaining a healthy weight. So, speaking of that, extra pounds play a weighty role. So the more weight that's placed on a joint, the more strain that joint has. So it's more likely with that extra strain and extra weight that those joints will get worn down. So primarily hips and knees are the primary ones that are affected by weight. So keeping a healthy weight can reduce pain. So by reducing that, it'll increase our mobility, and by decreasing our weight, we'll also slow the progression of arthritis. It's not decreasing your weight is not going to reverse what's already been done to your body in regards to arthritis, but it can decrease that progression. And then one other interesting fact is that fat is an active tissue. So as an active tissue, this fat can release inflammatory chemicals that can cause more inflammation. So as we improve our weight, we will have less inflammation just from less fat content in our body. And now let's talk about 8 specific foods and food groups that can decrease inflammation. So fish. So omega-3 fatty acids are a really important anti-inflammatory chemical that's found in fish. So these fatty acids contain EPA and DHA, and they essentially stop some of the inflammatory cascade. So they'll stop some inflammatory pathways that leukocytes and cytokines cause. So they'll stop certain types of inflammation right at the root of the problem. So increasing fish in your diet is going to be an important thing. So what type of fish are we talking? So we're talking marine fatty acids like tuna, salmon, mackerel, herring, and trout. Some things that we need to be aware of is the bigger type of fish. So we're talking tunas on there. Let me see what the other ones are. But the bigger type of fish can cause an increase in mercury. So we don't want to overdo it with certain types of bigger type of fish like the tuna. So mackerel, herring, trout, those are also good options. Salmon. And then how much fish? So typically 3 to 6 ounce serving. So a 3 ounce serving is basically the size of a pack of playing cards. So that's about a 3 ounce serving. So if we have that 2 to 4 times a week, that's typically enough that can help with inflammation. And those are healthy fats too, healthy unsaturated fats. So 2 to 4 times a week with those type of servings. What if you don't like fish? Oh, I can't stand fish. Well, there's also supplements too. So talk to your provider about supplements. So there's fish oil tablets that we can take that have the same omega-3 fatty acids that can help.
Omega-3, 6, and 9?
Yeah, so omega-3 specifically is what we're talking about here. We'll talk a little bit about some other omega-6s, but yeah, those omega fatty acids are typically good. Sometimes the omega-6s can be a little bit bad, but omega-3 is high concentration in fish. Yes?
So much fish you see now is farm raised, it's not wild caught, what do you do?
So, yeah, and I think some of the oils are not necessarily wild caught either. They still are healthy types still have a lot of healthy components to it. I would say wild caught is probably better.
Try and find it.
Yeah, so it is harder to find, but it's still, I mean, it still has the same components, so it's still fairly healthy, still has the same healthy fats. Yeah, but it is a little tricky because it is a lot harder to find these days now, just with how food's processed and production of food.
If you're taking a omega-3 pill, which I am, you can take too much, can't you? Can you take too much? I mean, how much is the norm?
Yeah, so typically about, I think it's 1,000 milligram capsule.
I think that's what I got. Yeah.
1,000 or 1,200 once a day is typically the recommended dose.
Okay, I take twice a day. Is that too much?
No, not necessarily. Just check the dose, but usually about 1,200 milligrams. But we don't really need to go in excess of about 2 grams or 2,000 milligrams. It's not really going to be super beneficial for us. Okay, so the next food that we want to talk about is olive oil. So olive oil contains a compound called oleocanthal, and oleocanthal works as an anti-inflammatory. And there's other specific types of oils that have the same type of anti-inflammatory properties. It works as an anti-inflammatory similar to anti-inflammatory medication. It may not be as potent, but the more of these anti-inflammatory foods we incorporate in our diet on a regular basis, we'll have decreased inflammation. So these other type of oils are grapeseed oil, avocado oil, walnut oil, and canola oil. So these all have that healthy anti-inflammatory chemical inside those. A couple things that we need to know with some of these oils is as these oils smoke, if we're cooking with them and they start smoking, that really destroys a lot of the nutritional value of them. So we need to make sure that we use oil that has either a high smoke point if you're going to be cooking at hot temperatures, or just that we're not cooking it so hot that it's reaching that smoke point and destroying some of that nutritional value that those oils have in them. All right. Cherries. So cherries are rich in anthocyanin, which is a powerful antioxidant and has an anti-inflammatory effect. There's been lots of research studies that have been done that show that cherries have this anti-inflammatory property. So cherries are one of these things that can be really beneficial. Some of the research, there's one specific study that showed, hey, for patients that drink 2 8-ounce glasses of cherry juice every day for a 45-day period of time, had a significant decrease in their pain that they were experiencing with inflammation. Obviously, we're probably not going to drink that much cherry juice. That's quite a bit of cherries. I think it's equivalent to about 45 cherries in a day, so that's quite a bit. But in general, the research is positive that cherries have this anti-inflammatory effect. So they can be pretty helpful to relieve joint pain, stiffness, and decrease inflammation. And they can also decrease some gout flares as well. So that's another medical condition that causes some specific type of arthritis as well. Other reds and purple fruits that can also be beneficial are strawberries, raspberries, blueberries, and blackberries. These all have that same chemical that has that anti-inflammatory component to it. Okay, broccoli. So broccoli contains a substance that can slow the progression of arthritis. So broccoli is loaded with antioxidants. It has vitamins A, C, and K to help against free radical formation. So free radical formation can cause inflammation, and it also is a contributing factor to heart disease as well. So these vegetables are pretty important for that. This compound that broccoli has, what is it? Sulfathane. These all so when you see a chemical that has some initials like the EPA, the name is typically about this long. So they have long chemical names sometimes, but sulfathane has a compound that will decrease inflammation and slow cartilage damage. So by slowing that cartilage damage, it's going to slow the progression of arthritis. Other cruciferous veggies like Brussels sprouts, cabbage, bok choy, cauliflower, they all have the same type of benefits. So any of these can be beneficial. And green tea. So green tea has polyphenols, which is an antioxidant that helps reduce inflammation and slow the breakdown of cartilage. All these different types of tea, green tea, white tea, black tea, they mostly come from the same tea plant. They're just processed all differently. But green tea specifically, on how it's processed, has a chemical known as EGCG, and it can slow the progression of arthritis by decreasing inflammatory producing cells, which will cause damage to that cartilage. So in order to get this, you should use a loose tea bag, boiled in water for 5 minutes. So different types of tea can be beneficial as well. Citrus fruits. So sometimes, I'm sure you've heard, like, sugar is an inflammatory food. So maybe in the past people have heard, oh, well, fruit has sugar in it, so it's going to make your arthritis worse. Not necessarily. So it's more processed sugar, and we'll get to that in a little bit and talk about foods that can make it worse. But citrus is actually helpful. So it's rich in vitamin C. It has an antioxidant that can help decrease the progression of arthritis as well. So it's also found in grapefruit, lemons, limes, and oranges, and is very important in the role of creating cartilage in your body. So fruits are very beneficial for this. Some things we need to be careful of, specifically grapefruit. There's a lot of medications that grapefruit can react with the pathway of certain medications, especially cholesterol medications and a few others. So just make sure you talk to your medical provider about which specific fruits are okay. Primarily grapefruit, if grapefruit's okay to take with any current medications that you're currently taking. So how much vitamin C? So the USDA recommends 75 milligrams for women and 90 milligrams for men. And these are commonly found in multivitamins. So you can just take a regular multivitamin, just check on the back, make sure it has just under 100 milligrams of vitamin C, and that should be sufficient. So that will provide some help with inflammation as well. But definitely getting these anti-inflammatory properties from the whole foods specifically, rather than vitamins, are probably a better route. Nuts. So nuts have a healthy amount of fat, protein, fiber, antioxidants, vitamins, and minerals. So specifically walnuts stand out. They have an omega-3 fatty acid that has anti-inflammatory properties, and that can be really beneficial. Almonds as well contain anti-inflammatory fighting magnesium and vitamin E. And pistachios also have some anti-inflammatory properties. So this says having to crack open the shells may slow eating and help with weight management. So we don't need a lot of nuts in order to get the anti-inflammatory effect. Typically it's only about an ounce a day, so it's not a ton. Pistachios, it's easy when you have a bunch of cracked nuts, it's easy just to throw them down pretty quickly. So pistachios help kind of slow that down just because it makes you work for it a little bit. But all these nuts can be beneficial. And garlic. So garlic has a compound that can help fight pain, inflammation, and cartilage damage as well. So all the foods in the allium family contain this compound that help fight pain, inflammation, and cartilage damage as well. So other type of foods, onions, shallots, leeks, scallions, can also be beneficial. Garlic isn't the only one. So this whole group can help. Other inflammatory spices like turmeric, ginger, cinnamon, and cayenne, they can all be beneficial for arthritis as well. A couple things specifically that we want to talk about is turmeric. So turmeric they sell it in capsules, and you can use that as an anti-inflammatory arthritis medication as well. So it has a lot of anti-inflammatory properties. And the other one, cayenne. So the chemical in cayenne, they use in capsaicin, they use in specific creams, arthritis creams, to help with your pain. So they typically help with like wrist pain, elbow pain, shoulder pain. So these creams can help decrease some of the inflammation and decrease pain as well. So they're in a lot of these creams that are already manufactured and they sell over the counter. Okay, so we talked a lot about the foods that are good to eat. Now let's talk about foods that are not good to eat and things that we want to avoid. Yes?
I have heard that you can take too much vitamin C, is that true?
Too much vitamin C. Yeah, typically your body does a good job at regulating extra vitamins and urinating it out. But yeah, the recommended we don't want to take too much of certain vitamins because it can cause problems. So yeah, some vitamins have, like, I know we can tolerate quite a bit of vitamin C in our body. And I know like the Emergency has like 2,000% of the daily value. It has quite a bit of vitamin C. And I feel like that's a little excessive. You typically don't need that much. Some of these extra vitamins, if they have too much, your body will typically just flush it out and urinate it out. But yeah, we need to be careful not to overdo things, especially with certain medications like vitamin K that can affect certain blood thinning levels, and medications that you might be taking that can be associated with that. So foods we want to limit and avoid. So back to the sugar. So sugar and refined carbohydrates. So these processed sugars will cause an increase in inflammation. So we need to make sure we're doing the best we can to avoid those. Saturated and trans fat, those typically come from red meats, fatty fried foods. A lot of that processed food has trans fats in them. So those are things that we want to avoid. Omega-6 fatty acids. So going back to omega-6 fatty acids, those can actually be harmful. So we want to make sure we're not overdoing it with certain types of fatty acids. The saturated fats are in full fat dairy products and red meats. And then the omega-6, let's see, omega-6s are often in processed foods. So they can use excess omega-6 fatty acids in processed foods. But some of the naturally occurring ones in like fish is definitely beneficial. Sometimes it's just used as a processing method as well to overdo it. So we want to go back to more whole foods, less processed foods and refined sugars. Salt and sodium, and then increase in alcohol, those can also worsen your arthritis symptoms. So these are things that we want to avoid so we can have less pain. Okay, and then some more tips for managing arthritis. So diet is just part of the puzzle. So there's other ways to help manage our pain. So staying active, exercise is an effective way to reduce pain and increase that mobility of those joints. So staying active is a huge part of osteoarthritis and improving your pain. Learn about medications. So there's certain medications that can be prescribed. So let's say obviously I would say losing weight and focusing on diet is kind of the primary treatment. So that's what we want to focus on first. When we feel like, I've been doing this and I'm still struggling, still having a hard time, still struggling with pain, you can talk to your medical provider about certain medications, certain anti-inflammatory medications that can help with pain. Sometimes we can do joint injections that can help decrease some pain and inflammation in your joints. So we do that a lot here, and that's something that we can offer for you here as well. And then obviously keeping a positive mindset, positive attitude is helpful to help keep you reinvigorated so you can continue to do these things and continue to stay active. Okay, so just in review, so we talked about specific foods. So we talked about arthritis in general. It's a common condition that is marked by pain, inflammation, swelling, and makes it hard to do the things we want to do. We talked about specific foods that can really help fight those inflammatory pathways so we have less inflammation in our bodies. We talked about fish, olive oil, cherries, broccoli, green tea, citrus fruit, nuts, and garlic, and others within that family as well. Foods that we want to limit and avoid: sugar, refined carbohydrates, saturated fats, omega-6 fatty acids, salt, and alcohol. So those are things that we want to limit. And then we talked about diet is not the only way to help manage arthritis. There's medications, sometimes injections, weight loss, and other things that we can do to help manage this. And obviously keeping that positive attitude so we can keep going and keep trying to stay healthy and be healthier. So that's an important part of this. Yes, questions?
Ice cream.
What was that?
Ice cream.
Ice cream. So ice cream has a lot of saturated fat and a lot of refined sugars. So it's not necessarily one of those things that's going to be helpful. It's going to be on that list of harmful things. So we need to make sure we limit that in our diet. Any other questions?
If you were to have ice cream, what constitutes this? Nothing.
Well, we want something that's a little bit more natural and has more natural sugars rather than just processed sugars. So some ice cream that has some real fruit in it. But yeah, typically ice cream has processed sugar
What about
and saturated fat.
organic ice cream, is that,
Yeah, that's going to be more of
because
a
I was getting.
of an unprocessed sugar. Yes.
Because I was getting the Sprouts brand of organic ice cream.
Yeah. So I would say that's definitely a better option. And then the biggest thing is, hey, we need to limit our quantities. I'm not saying, hey, you can never have ice cream again. We just want to limit our quantities and make sure we're balancing things out well.
Which is hard to do once you start.
Sometimes it is. All right, any other questions that we have? Well, thank you guys very much for coming out. I really appreciate it. We're here in the community center. Nancy's helping us run this. We have lots of events to help keep you happy, keep you healthy, and keep you involved in your healthcare. We want to make sure that you're being proactive about your healthcare, and we want to help you do that. So that's why we have this all set up for you. If you have any questions, feel free to ask me afterwards. If you're new to the office, talk to Tom and Kim, and they can get you a tour, have you check the place out. Or if there's another place closer, they can set you up with a different person to help give you a tour of a location that's close to you. But I thank you guys very much for coming out, and I'll probably be seeing you next month for another chat. Hopefully you guys can make it then too.
Thank you, Daniel.